Good morning, everyone, and let us get started. Welcome to the first Chicago Safety Net Quality and Safety Symposium.
I see us as partners as we move forward in taking on quality and safety in our healthcare system. We totally embrace the triple aims: improving the quality of care, improving the health of populations, and reducing the growth in healthcare costs. This is completely aligned with national healthcare reform. It's completely aligned with state Medicaid reform. This is, to us, the place we need to be instead of worrying about and hopefully putting behind us budget cuts and thinking about delays in payments.
I spent several years working on a large health system board of directors, and I remember how the first item that ate up that board agenda was always finance. And if you were lucky, quality was the last thing on the agenda, and the meeting was running late by that time, and it got 10 or 15 minutes. Move quality to be number one. What can be more important than what you're doing for your patients and how well you're doing?
The system that you have produces what it produces, and it will keep spitting out things at the defect rate that it spits it out until you radically change the system.
We do the patient safety culture surveys, and we learned there we had a long way to go in getting the mindset, the culture of safety throughout President's Health. So we put the hotline number in. We put a lot more focus on anonymity. And we have increased the reporting on unsafe practices in some areas by 300%.
Everything we do has a reproducible, structured way of doing so. And it's not that we don't let people be creative, but it is really important to keep everyone using the same processes, and it really has worked for us.
Bad things do happen in healthcare. But if we're intellectually honest about it, we're going to learn and test our own systems to make sure that are we as good as we think we all are. But as we walk around our organization, there are things every day that certainly are not going according to the way we would hope they should be.
The unifying concept is, what is our culture of safety? And each of these layers of information give us insight into what that culture is. Healthcare organizations must develop a safety culture so that an organization's care processes and workforce are focused on improving the reliability and the safety of care for patients.
Would you be able to give us some pointers? When are we sure that the just culture exists in an organization?
It doesn't exist just because you're rolling out a program that's called Just Culture. And it doesn't exist 5 years later because you've rolled it out and everybody says they have a program called Just Culture. Healthcare organizations are quite prone to having a lot of fear in the organization. Fear of getting fired, fear of a mistake being uncovered. I mean, doctors are wound up pretty tight as far as their personalities and about making errors and having them exposed.
When it comes to clinician engagement, culture is the omnivorous one in the room. I would just point out to you that if you want to engage clinicians in quality or culture change or safety, administrative simplification is huge.
The main thing I wanted to tell you is, even though I'm rural, you're urban, we share a lot of the same characteristics. We have pretty much across the board, we would match on our mission, vision, and values, I would think.
The question I have is related to the degree to which you have plans to demonstrate that any of your particular programs that are clearly improving quality are also affecting the cost of care.
I can definitely speak to that. The study that I told you, the retrospective one that looked at 100 CHF patients, we demonstrated from 1 year to the next, the year before health coaches and the year after, that those patients reduced their readmissions to the hospital and their readmissions to the ED by $1.3 million. I made a wager with the president of the hospital. I said, give me 3 nurses in 1 year. If I fail, fire me. And the following year I went back and said, we saved $1.3 million, you can't fire me. And he said that goes down in his history as the best thing anybody ever gave him as a president on Valentine's Day.
Every conversation in the hospital that we have, either to make an investment, to hire someone, there is always a question collectively that we ask ourselves, how does that help our patient.